Just thank you for having me on National Eye Exam Month. This is a very, very important time for you and your colleagues.
Yeah, thank you. Thank you for having me, sir.
Okay,
Yeah.
but it's not just like during the month of August, it's important to get your eyes checked. Getting your eyes checked is something that everybody needs to do. How routinely and how often should we do this?
Right. It's always good to have your eye exam every year just for you to check, how good or how bad your vision is. So it's also important to check if you're having those, severe eye problem. Like for example, it's cataract that usually starts the age of 40 up, or sometimes at the early age of 30.
Because it's part of the natural aging process. I mean, your eyesight will get progressively worse as time goes on. It starts to get less and less perfect, I guess. Or,
True. I heard about that progressive that you said. Yeah. In progress, the eye problem starts at the age of 30. At the age of 30, and then actually people starts to get their progressive glasses when the age of 40. So usually people that age 40 starts to be prescribed with progressive lenses, where are glasses where you can use for both far and near. So
now, when we go get our eyes checked, like I just turned 51, and I know that I've had astigmatism for maybe a decade now. I didn't know what astigmatism was when I got it at 41, and I was actually kind of worried. But they said no, if you need reading glasses, if you have astigmatism, if you're nearsighted, if you're farsighted, these are all different conditions that you guys are well equipped to handle and recommend what kind of glasses people may need.
Right.
Yeah. So what do you look for as an eye care professional?
I hear you say 51, right? So at the age of 51, usually we offer, or the doctor prescribe you or offer you glasses. It's called progressive, which, as I said, glasses that you can use for both far and near. And then, higher stigmatism, usually vulnerable to reflection and bright lights.
And I had 20/20 vision up until the time when I was 40, but then the physicians were just telling me, they're like, yeah, you're getting a little bit older. This is perfectly natural. Don't worry about it and everything like that. You may need to wear glasses, maybe just for reading, and then maybe bifocals as you get much older. But they said this is just part of aging.
Yeah, usually when people say they're okay, but once they tried wearing glasses, that's the time when they feel the difference between having the glasses and not wearing glasses. Usually, sometimes. People use their tolerance and they think they're okay, but once they experience having glasses, that's when you find out that, the difference between having one and not having one.
Sure.
So, especially as you said, if you're having a higher astigmatism, it's always good to have a glasses with anti-reflection, which is, we call it AR, and the transition.
Okay, now
that
how
changes
about
color from
how about just because we all are coming off this 2 and 3 year period of when everybody was glued to their screens during coronavirus, and we were all reading off our phones all the time and everything. Some people got the blue reflective lenses. People wanted the UV lenses. Are you seeing people with more concerns with eye health because of that time?
Yeah, because especially the kids that are more exposed on the gadgets. And people are now spending most of their time on their phone, and it's always good to see the doctor, just for you to know if you're getting affected with too much time on the screen. And
sure.
Yeah.
Okay, now let's talk about for the young people that are watching this right now that have maybe never had an eye exam since they were babies, right?
Yeah.
What do you actually look for? Because there's the eye test where you stand what is it, 15 feet away, 20 feet away, and then you read the lines, and there's that thing where you blow air into the eye. What do you do right now? What does technology provide you?
That's a good question. I mean, the kids, it's always because the kids doesn't know the difference between clear and not so clear. So it's always good to go to a clinic like us where you can see the professional and give them advice on how to use the glasses properly, and give the parents an advice on how to teach their kids on when to ask their kids if the glasses are working or not.
So Abriana, thank you for having me today, but more importantly, thank you for what you do for the community, because you're really doing the Lord's work if you're helping people to see better.
Yeah, I guess you can say that. Yeah.
Okay. Okay. As a technician, what equipment do you work with? What are you looking for? How are you trying to set the patient at ease? And like how do you assess somebody's eye health?
So first we start with general basis of screening. So we give them a dry eye exam. We then will dilate them. So Dr. Lombard or Dr. Klosek or Dr. Archer can go ahead and see if they have any issues in the back of their eye. We also check their eye pressure as well as get the natural prescription of their eye.
What do you see as some of the more common, let's say, anomalies of like a Guam patients and everything? Because we got a wonderful paradise climate and everything like that, but then people also
Yes.
get like dry eyes or those crazy gnats that will come around after it rains and everything. They go right inside the eyelids.
Yeah, so a typical symptom that we usually see in the office would be like dry eye syndrome. So usually patients will complain of like gritty sensation, or it's kind of like they get like mugu or like mucus discharge in their eye. So we recommend like artificial tears and warm compresses for that.
And mugu is the scientific term for that, right? On Guam.
The Chamorro term, yes.
Exactly. Okay, how do you set the patient at ease? Because like a lot of the equipment and everything, even though technology has made it so
Yeah.
so worry-free and everything like that, people still get like a little bit nervous, I would assume, right?
Yes, they do. A lot of patients still get a little nervous when they see them, but that's why we try to like win them over with our warm welcomings, as well as letting them know that what we're doing, everything will be looked over by the MD or the OD. And usually with Dr. Lombard's bedside manner, patients love that.
What's some of the training that you've had to have to be, a very effective healthcare practitioner?
A lot of the training I would say comes from the patients. I would say I look at them and view them as they're my grandparents. So I would treat them with nonetheless but with respect. So it helps me build that kind of like patient and worker rapport. So I can kind of see how I should treat them. Kind of like, set them at ease in a sense.
So another proud thing is a proud chamarita, right?
Yes,
That
of
comes
course.
across. Your bedside manner is excellent too.
Oh, thank you.
Okay, now if you don't mind me saying so, obviously you wear glasses. Do you feel
Yes.
that gives you, as a healthcare practitioner, like a certain sense of empathy with the patient? 'Cause
I think that I can relate more so with the patients, especially if they're having issues with their glasses. I would recommend like the type of lens that I have, or if we have, I would say if I can gear them like, oh, are you a contact lens wearer or are you just a full-time glasses wearer? It'll kind of gauge how the appointment will go to when they see the doctor.
Okay, now one thing I just realized looking at your equipment, right? When people take like the eye test, it's not like if you go into like another type of medical clinic and they're like, so how are you feeling today? Like, how's your pain? And they're like, oh, I'm a 3, because they're afraid of being like on it. You can't falsify like an eye test.
You can't memorize the chart either.
So how do you set the patient at ease for that? And then just say, just be yourself, just be honest.
Usually I would always recommend that they're completely honest with their entire health history in terms of like if they have any diabetes. That can kind of gauge how the appointment will go to as well. Or if they have any like hypertension, or if they're on, I would say like, what is it, steroids? Yeah. They're on steroids, it'll kind of gauge where their vision is, and looking at their history of their medical history, how the appointment will go, if that makes sense.
And obviously, it's so important that you get your eyes checked each and every year as part of your like normal annual medical workup. But let's talk about how it's been for you to administer like eye exams for our kids and for the Manomko also.
Oh yes, for the kids, they're my favorite. I think they're my favorite kinds of patients. I always love to see the little kids in here, and always. It helps me like kind of like a breath of fresh air. It's like when the little kids are having issues and they're like fussy, but then they leave, they're always happy because they either get a pair of glasses or their parents are happy that there's no issues going on there. But especially with our Manunku too, a lot of the times they're very concerned about their vision. They don't want to go blind. So once they do proceed with like, for example, cataract surgery, like we hear nothing but glowing remarks. And it just makes me feel happy too, because it's kind of like serving the island in a way that I didn't know I was able to do.